My name is Professor Nora Groce. I'm the director of the University College London Center on International Disability Research, and I'm here to talk to you today about World Disability Day, but more specifically about people with disabilities worldwide and why you as future physicians should be very involved with, knowledgeable about, and care about this large component of the human population. People with disabilities make up about 15% of the world's population, we now think, about 1 billion people worldwide. We talk about people with disabilities, but what we really mean are people with physical, sensory, intellectual, and mental health impairments that make a difference in their day-to-day lives. Very importantly, the lives of people with disabilities are impacted not just by whatever their specific impairments are, but by the fact that they often face a tremendous amount of social, economic, and political barriers that hinder their ability to participate freely in the communities in which they live. And also, very importantly, in many cultures, they continue to face stigma, discrimination, and much of the population not understanding disability. So the issue is not just disability alone. It's not a person's individual attributes that we care about. It's also the surrounding environment in which they live. People with disabilities, we often talk about disability and whether the numbers are increasing, decreasing. In fact, it's a balancing act. Improved healthcare has made a difference for millions. So for example, in the 1980s, about 350,000 people a year, mainly children, were disabled by polio. Last year, the numbers were only in the several dozen people per year are impacted by polio. The same thing with something like eye clinics for cataracts. Millions now receive basic cataract surgery and are no longer have to face a lifetime, usually going into old age with blindness. However, millions still are in need of such services, and more than that, they're in addition to Western medicine often making decreasing the numbers of people with disabilities. Good medical care often is now keeping alive millions of people who previously would have died from a disabling injury or illness. So, for example, people who are now injured, gravely injured, often survive even with very serious injuries and survive for decades. Fragile newborns that previously would have died now grow into adulthood and become part of our communities. Just as importantly, people with chronic diseases, for example, diabetes, now often live, but they live with a disability. And it's also true for people with infectious diseases such as HIV and meningitis. And another component of the population that we're aware of is people who are aging. Around the world, the largest component of all societies, all populations, are people who are age 60 and above. Just because you become old and then elderly doesn't mean, as you go into old age, that you will become disabled. But the risk of you becoming disabled increases considerably as you grow older. So by the time you're in your mid-80s, should be lucky to live that long, you have about an 85% chance of living with at least one disabling condition. The issue is not just the fact that the numbers of people with disabilities will continue on into the future, although again, the nature of their disabilities may change, and you as future physicians will be at the coalface really dealing with this new and emerging population. But very importantly, there's a very large body of data now and over the past several decades in particular, that shows us that the lives of people with disabilities are really impacted not just by their disability, but by the communities in which they live. And very importantly, I should say, the World Health Organization tells us that you can be both disabled and healthy. So a person's disability will be affected not just by their physical attributes, but also their right to an education, their right to participate in the social and economic lives of their communities, the right to vote, the right to decide when, where, and with whom to live, and the right to have a family, to have children. All of these things are issues that are socially defined. And if they're socially defined, they can be socially redefined, which is why there's also an emerging architecture for human rights around disability that's important for you as physicians to know about. There's a new UN Convention on the Rights of Persons with Disabilities that has now been ratified by over 180 countries worldwide. And this new convention gives not only human rights, but legal rights to every disabled person in the countries that have ratified the convention. This is very important. The issue is not getting assistance or support to people with disabilities. It's no longer an option, it's a right. Just as importantly, the new Sustainable Development Goals, well, they're not quite new, they were passed in 2015, but they run to 2030, and they're kind of like a global to-do list for international development and global health issues. And they clearly call for the fact that all people must be included and reached by all the objectives and programs and policies that come in under these goals. There's a call to leave no one behind. That's not in there by accident, and the disability community spent a great deal of time pressing to make sure that was in the Sustainable Development Goals, so that any international development project or public health initiatives, be it clean water or new transportation systems or the right to access basic health care or public health initiatives, all of those have to take people with disabilities into account. And very importantly, all of these issues feed into another major issue when it comes to healthcare for people with disabilities. We often raise the issue of healthcare for people with disabilities, and it immediately becomes a discussion of what people need for their disabilities. Now, some people with disabilities will need treatments of various sorts for their specific disabilities. Many, not all, will need rehabilitation. And others will need access to specific interventions at certain periods of their lives as related to their health, as related to their disabilities. But even more importantly, or just as importantly, people with disabilities need and often are overlooked when it comes to access to basic health care. So an increasing number of studies, for example, show that disabled children often see a number of specialists, but nobody is giving them their basic childhood immunization shots. Or there's a large body of data now that shows that young people, adolescents with disabilities are not getting basic information about sexual and reproductive health. Access of disabled women to maternal child health services. All of these things that come under the aegis of good basic health care and basic public health care is something that we need to pay attention to. It is not the disability alone. It is the fact that people with disabilities are members of the general population, and as all members of the general population will need basic flu shots, and they'll come to you needing things like birth control and whatever anybody else will walk in your office asking for help with. People with disabilities will be part of that community as well. And if you're not getting people with disabilities in your practices or in your programs for general health care, then your question should be why, and why are you not getting them through your doors? So again, it's not just the disability, it's the right to general health care that we really need to pay attention to. And lastly, we should also, I should also note that there's all sorts of new things coming down the road that we think will impact the lives of people with disabilities. Certainly the new legal architecture is one. Also, technology is often used when we talk about disability. Technology will make a difference in the lives of people with disabilities. Hopefully, yes, technology makes a difference in the lives for us all. For people with disabilities, the issue is both technology and the ability to afford technology and the ability to equally access technology. There's certainly, all of us have seen in the news things like very sophisticated wheelchairs and exoskeletons that allow people who have spinal cord injuries to walk. But just as importantly, there's lots of low-tech devices that are being designed for the whole community that are really making a difference in the lives of people with disabilities. One example, iPhones allow members of the deaf community who are sign language users for the first time to easily communicate across the community, across their countries, and who are now able to be in close touch both in terms of social and community participation and work obligations. If you can speak sign language over an iPhone, you suddenly don't have to be there in person to communicate. These sorts of things, which are part of a universal design for all individuals, are really making a difference in the lives of people with disabilities. Finally, and it's critically important to emphasize this, we see people with disabilities as a very important group that is all too often overlooked when we're talking about planning into the future for improved population health and for outreach and for community participation. There is, over the past 30 years, there has been a global disability rights movement. People with disabilities are not just the subjects of outreach efforts and community goodwill. People with disabilities have the right and the voice to speak for themselves. The global disability rights movement, and it's a global movement, but there are disability rights organizations in every community. Every country in the world has not just one umbrella disability rights group, but often dozens. And Zambian National Association of the Deaf, the Nepalese Disabled Women's Association. All of these organizations are speaking for, not just for, but they're organized by and they speak on behalf of people with disabilities. The tagline for the disability rights movement is "Nothing about us without us." And it's very important that when you want to do anything with or for disabled individuals or populations, that their voices be included, their opinions be sought, and their buy-in be assured. It is not a population you just go out and do something for. Like any population that represents a group of people within the community, it's very important that their voices be part of that. And as part of that, it's also very important, and I should note that an increasing number of young people with disabilities are joining the health professions. They're getting degrees in medicine, in public health, in occupational therapy. These people will be your peers. And so it's important, again, not just that you think of medicine as serving people with disabilities, but also that you think of people with disabilities as colleagues and future colleagues that you bring in and that you work with collaboratively to address what the needs of people with disabilities are now and into the future. Again, this is World Disability Day. It's intended to get you to pay attention to disability. But like any of these days, it's one day a year. We're talking about 1 billion people, 15% of the world's population. 1 in every 4 households has at least one member with a significant disability. For all these reasons, you need to know about disability and you need to see people with disabilities and the disabled populations as an important component of any population you work with, any outreach efforts you make. This is a population with tremendous untapped potential, and it's part of your role as a physician to ensure that you include these people and make use of this potential as you move forward. So happy Disability Day. Please feel free to get in touch if you have more questions. I'm Professor Nora Groce, University College London, and thank you for listening.